Local anesthetics are the most commonly used drugs in dentistry. There are 5 adverse reactions of commonly used local anesthetics, and these are psychogenic, allergic, toxic effects, methemoglobinemia, and paresthesia. Psychogenic reactions. Anxiety-induced events are by far the most common adverse reaction associated with local anesthetics in dentistry. This may manifest in numerous ways, the most common of which is syncope. In addition, they may present with a wide variety of symptoms, including hyperventilation, nausea, vomiting, and alterations in heart rate or blood pressure. Psychogenic reactions are often misdiagnosed as allergic reactions and may also mimic them, with signs like urticaria, edema, and bronchospasm. Patient reports of allergic reaction to local anesthetics are fairly common, but investigation shows that most of these are of psychogenic origin. True allergy to an amide is exceedingly rare, whereas the ester procaine is somewhat more allergenic. An allergy to an ester rules out use of another ester, as the allergenic components is the breakdown product para-aminobenzoic acid, and metabolism of all esters yields this compound. In contrast, an allergy to one amide does not rule out use of another amide. Allergy to epinephrine is impossible. A patient may be allergic to another compounds in anesthetic cartridge. For example, methyl parabens are preservatives necessary for multi-dose vials and were present in dental cartridges in the past. They are no longer included as dental cartridges are single-use items. Allergy to para-aminobenzoic acid would rule out the use of esters and methyl parabens. It may be best to avoid a vasoconstrictor if there is a true documented allergy to sulfites, as metabisulfite is added as an antioxidant whenever vasoconstrictor is present. Vasoconstrictor can be used in patients with an allergy to the sulfonamide antibacterials, commonly called sulfa, as there is no cross-allergenicity with sulfites. The toxicity of local anesthetics is a function of systemic absorption. High blood levels of drug may be due to repeated injections or could result from a single inadvertent intravascular administration. This is one reason why aspiration before every injection is so important. There are 4 toxic effects. Number 1, primarily neurologic signs. Number 2, may initially manifest as sedation, lightheadedness, slurred speech, mode alteration, diplopia, sensory disturbances, disorientation, and muscle twitching. Number 3, higher blood vessels may result in tremors, respiratory depression, and tonic-clonic seizures. And number 4, if severe, may result in coma, respiratory arrest, and cardiovascular collapse. Recommended maximum doses and number of cartridges of local anesthetics with vasoconstrictor are as follows. The maximum dose of articaine is 7 mg per kilogram up to 500 mg. And in children, it is 5 mg per kilogram, and the number of cartridges is 7. The maximum dose of bupivacaine is 2 mg per kilogram up to 200 mg, and the maximum number of cartridges is 10. In lidocaine, the maximum dose is 7 mg per kilogram up to 500 mg, and the maximum number of cartridges is 13. The maximum dose of methemoglobinemia is 6.6 mg per kilogram up to 400 mg, and the number of cartridges is 11 or 7 if plain. And in prilocaine, the number of dose is 8 mg per kilogram up to 500 mg, and the number of cartridges is 8. Methemoglobinemia. This uncommon adverse reaction is associated most notably with prilocaine, but may also occur with articaine or the topical anesthetic benzocaine. Methemoglobinemia is induced by an excess of the metabolites of these drugs and manifest as a cyanotic appearance that does not respond to the administration of 100% oxygen. Cyanosis becomes apparent when methemoglobin levels are low, but symptoms of nausea, sedation, seizures, and even coma may result when levels are very high. Prilocaine, articaine, and benzocaine are best avoided in patients with congenital methemoglobinemia. Prolonged anesthesia or paresthesia of the tongue or lip are known risks of surgical procedures such as extractions, but may also occur following non-surgical dentistry. Most of these reactions are transient and resolve within 8 weeks, but they may become permanent. Articaine and prilocaine were reported as more likely than other anesthetics to be associated with paresthesia, a difference that was statistically significant when their distributions of use was taken into account. Such reactions have most commonly affected the lingual nerve. So far, the reasons for these findings are speculative only. There are 7 factors affecting onset and duration of actions of local anesthetics, and these are: number 1, potential of hydrogen in tissue; number 2, protein kinase of drug; number 3, time of diffusion from needle tip to nerve; number 4, time of diffusion away from nerve; number 5, nerve morphology; number 6, concentration of drug; and number 7, lipid solubility of drug.